This is Facts from the Frontlines, St. Michael's Hospital Foundation's inaugural COVID-19 podcast series, where our world-leading experts provide the knowledge you need to keep you safe and informed.
My name is Bob Howard, and I'm in the St. Michael's Hospital Foundation boardroom with two of our St. Michael's doctors, Dr. Joel Lockwood, who's one of our emergency department physicians, and Dr. Paul Das, one of our family practice physicians here at St. Michael's. Both of them have been involved in a really important initiative that recently came online, and that is the Medical Assessment Center for COVID. This center opened on Monday, March the 13th to see patients and is now up and running. Setting up the center to assess and advise and potentially test patients who might have COVID, but doing it outside the hospital, close to the hospital, but not in the hospital, I think is an inspired idea. And Joel and Paul are here to talk to us about how this all happened. So my first question, gentlemen, is just that. Where did the idea for this come from, and how did the two of you get involved?
It's a great question. I actually don't know how the two of us got involved, but I think it's a neat story. I think Joel might have been involved even before I got in or asked to join. Do you want to?
Yeah. So we knew that we kind of saw the rumblings of COVID, and then there were cases in Canada, and our chief, Carolyn Snyder, who I think has been quite visionary in all this, knew that we needed to have a plan pretty early. So she put out a call amongst our physician group about if there was any interest in anyone becoming a lead of designing a COVID center. And that was really about it. And then I was tasked as the emergency lead, but I think it was a really good idea that we kind of viewed the COVID center, even at the most broad strokes, as a mixture of emergency medicine and family medicine. And so I knew that there was going to be someone from the family medicine group at St. Mike's as well.
In the few weeks prior to Joel and I meeting, I think we were seeing the pressures of this in our own clinics, the challenges of assessing someone with a COVID positive screen, and then also formally testing that person at our site was requiring more and more demands in terms of people, PPE, and navigating.
PPE is
a huge issue, right?
But just people may not know.
Oh, certainly. So PPE is personal protective equipment. So typically face shields, surgical masks, gowns, gloves, and I'll do my best not to use any acronyms moving forward. So this placed lots of challenges on our day-to-day operations at the family health team level. And then similarly, the chief of our department, Karen Wayman, had asked me to join a meeting the following week where Joel and I first met.
So when was that? When did you start meeting?
What day was that? Do you remember? Was it a Wednesday?
It was a Wednesday. I'd say March 10th or something.
So yeah. March 10th.
Yeah,
not that long ago.
So we've been emailing because we knew of each other, and so I have some of my colleagues and close friends in the department are friends of Paul. So I knew that Paul was a good guy, and I was pretty confident I knew it was going to be a good fit early. And then, I think we had a plan just by email that we were like, we need to we kind of have our own ideas of what's important in this thing. But I think what we need to do is we need to kind of sit down and hash this out. And even at that time, rumblings of where it was going to be hadn't really been fully decided. There was a few locations we were looking at. And so I think it led to Paul coming over, basically. So Paul showed up at my house at 8:00 one night. And we just kind of figured it out that evening, I think. And he, on his computer, made a mock-up of our current location that you made, just that evening. Mm-hmm. And we just figured it out.
So what is it? Like, most people are, would be very interested, but they're not ever going to go in there. So can you give us a word picture of if you come in the door and what do you see?
Certainly. So I think when Joel and I sort of started envisioning it, we prioritized patient safety and staff safety. And I think the messaging around maintaining this distance of 2 meters was important for all of the steps that we designed. So the typical visit that a patient experiences, the lineup is outside to minimize time spent indoors with patients. Patients are instructed to maintain a distance of 6 feet or 2 meters apart from each other. And then there's a greeter in our vestibule that's on the south side of this building that we have called Vikash Shooter in Victoria. So security and our greeter control entrance to the building with the use of an automated door. Patient then places a surgical mask to cover their nose and their face. And then they're slowly instructed to approach our registration desk. At the registration desk, registration occurs with almost zero contact with the patient. And then they're guided with a runner who is dressed in full personal protective equipment to one of 5 assessment stations. This is typically where a nurse or another health provider from the hospital performs our assessment. And this is probably, I think, the most important piece of what occurs here in the assessment center. So presently we're asking about past medical history, medications, travel. We're taking vital signs such as temperature, heart rate, respiratory rate, oxygen saturations, and then determining whether this patient has symptoms, meaning fever, runny nose, cough, sore throat, muscle aches, nausea, diarrhea. And then finally, we go to our decision tool. And this has evolved over the last couple of weeks. Initially, we were getting daily updates, but presently we are testing the big transmitters to our population. So if you work in a high-risk occupation, if you live in a vulnerable setting, or if you've been directed to our center by Toronto Public Health. I think the most important piece that occurs here is education on self-isolation and what that actually means, what processes to follow in home or at home. After that is followed up with either an exit from the building through our northeast exit, or testing that'll occur in a separate pod that we've created on the east end of the building. All of the processes that we've designed really take staff safety as number one. So each of the spaces maintain a distance of 2 meters from patients. Our staff are donned in full personal protective equipment, and also with the mindset to preserve and utilize personal protective equipment judiciously. Do you have anything to?
Yeah, I think that when we designed it, we kind of just filled it out on a piece of paper, and one of the things I'm most proud of is how similar it looks to what we initially designed. We had to do a lot of work to make sure that all the pieces worked, and we had an amazing team, which I can't thank enough of. People from facilities that figured out how to get these things built, people from infection prevention and control that made sure that we're making things out of materials that would be as least sort of transmissible as far as holding viruses.
I guess cleanable.
Exactly, yeah, and that's it. So there's no cloth. It has to all be kind of a solid material, just like a vinyl, so you can wipe it with a cloth. People from our communications department that help make signs, tell people where to go, and places like feet on the floor so people know where to stand, and stop signs so people know where to stop. Security that's kept us all safe, and then all the frontline workers. It's been a really good experience. I think we're quite proud of the results.
So my understanding is you actually put this together over a weekend.
Yeah, so that part is, so the first 10 days from the drawings on a piece of paper to when it was made, the first sort of 6 or 7 days were figuring out the logistics of where's a wall going to go, what's a desk going to be made of, where are we getting the desk from, how high is the plexiglass going to be for the registration staff, all of those types of things. And then, I worked an emerge shift on a Friday evening, and I finished at about 9:30, and I came by, and there was a lot of our facilities crew, the construction workers, were starting to put things together. Apparently they finished, actually that's not true, it was a Saturday evening. They finished Sunday morning at 4 or 5 in the morning. And then we did staff training, I think starting around noon. And then we opened the next day.
And where did you get the staff?
It's a great question. So staff are from all over the hospital. So our outpatient departments, our inpatient departments, and obviously the COVID-19 situation is affecting many of our day-to-day operations. And we're all being pulled in different directions. So that's typically where we've...
So I guess this is an example of redeployment of staff. So one of the things St. Michael's has done is postponed a lot of elective or planned procedural type work, surgeries and others. And those folks could be redeployed. And I guess some of those would be people who are now working in the assessment centers.
Yeah, definitely.
Is that correct?
We've leaned really heavily on our family health teams. It's staffed primarily by our general practitioners from St. Mike's. And so that was part of the design too, is that Paul and I thought it was important to staff it with family docs that, otherwise their clinics are probably a bit more affected, and to not have emergency docs because the potential of cross-contamination is quite important to us. We designed the other kind of aspects of our design include that too. Like, we thought it was quite important to have it outside of the physical space of the hospital.
Right.
So it's completely separate. No staff are working really in both places right now, for the most part. And if a patient goes through that was positive, we've got all of these infection prevention controls and protective gear and stuff like that, but they're also not coughing on the door handle in the emergency room. And that part I think has worked out well for us. One of the things we kind of thought from the beginning was, we know that COVID is going to be here for a while, and things are going to change. And we knew that the first phase would be people getting tested, right? It was right around March break. People are sick. They're really worried about it. They're worried that they might have it or pass it on to their family. And we needed to offload the emergency departments to let them do their normal work and also get ready for the next wave, which I think is going to be coming now. And so I think that that'll be hopefully one of the lasting legacies of our center, is that we kind of gave the emergency team time to prepare.
So that kind of leads into my next question, which is, who should go to an assessment center? If I'm at home, should I go? Like, what would be the reason for me to go?
Well, right now, I think it's important to understand that testing is different than what a lot of people think. So initially, testing was essentially for any symptomatic person, and that's since changed. Now, really, the people that we're testing are healthcare workers that have direct patient contact. So that's our kind of frontline staff. And a lot of that is to make sure that they can be cleared to go back to work, and to make sure that if we identify that they have COVID, that they're at the lowest possible risk of transmitting it to their patients. Second is vulnerable populations. So that's going to be people that are homeless, people in prisons or in nursing homes. And I think that COVID knows no boundaries, and unfortunately...
So the reason for that group is?
Well, it's to try to prevent outbreaks in homeless shelters or nursing homes.
Where their living environment is one where close contact is...
there's
no option.
They're medical, they're not really able to isolate, as a lot of people that have houses are, or have apartments where they can kind of lock themselves in. So if they're in quite crowded living conditions in a homeless shelter, where there are oftentimes a lot of chronic medical problems that put them in the higher risk group, we wanted to avoid that at all costs. And then the third is, people that have been sent in by public health. So it's important to know that if you don't meet one of those criteria, it's unlikely that we're going to test you now. So the people, if they don't, the value that we provide is we're an education center. So we can go through, when you're going to want to go to an emergency room, the things that need to scare you, how to self-isolate, what that means, the things you can and can't do. And so we've adapted a bit from our previous function, which was more testing, now to a bit more education.
So, because one can envision that there are people at home, not everybody has a family doctor, unfortunately. And it may not be so easy to get your family doctor. They're obviously, their offices are often closed and they're doing telephone medicine. And whether you can get through or not, I guess, might be variable. So if I'm somebody at home and I'm sick and I'm worried that this might be COVID, can I come?
Certainly. So we are open to all comers. We're open to the public. There's no appointment needed. We're open from 9 a.m. every day till about 1 or 1:30. We close for cleaning of the whole facility, and then we're open again from 2 p.m. till 7 p.m. So we are 7 days a week. So certainly we are available for assessment, education, plus or minus testing for the appropriate populations. And that may evolve and change as the ministry in Ontario Health provides us direction. But we are here to provide education. I think the first step is trying to connect virtually with your family physician, nurse practitioners, and your usual modes of care. I think family physicians around the city are making great efforts to provide that level of care. And I will say from my family physician that our day-to-day operations have been turned upside down, and we're rethinking very creatively on how we provide adequate care for all of our patients for their needs concerning COVID and non-COVID related issues. So I would recommend to try that avenue first, and then if you need an in-person assessment, we are probably one of the safer areas to come to seek care.
Okay. So testing, we hear a lot about testing, in the media. So especially south of the border, if you watch CNN, that's literally all they talk about is testing and do we have enough testing. So you guys do testing. And right now, I think you've told me what your priority groups are for testing. Do you see that changing at all? I mean, there is an issue of testing availability. It's a complicated test. It requires a special expertise and a special equipment, and it's not infinitely available. And actually, I think there's more of it available today because St. Michael's is actually open testing at our site. We didn't actually have that at the beginning of all this. Public health had it. So the ability to test is going up. I don't know whether it's going to continue to go up or not, but do you see that you may be doing more testing in the future than you are actually doing right now?
Yeah, so I mean, I think that who we're testing, I think it's important to say, is out of our control. We are mandated. The criteria of how and who gets tested is dictated to us. And that's similar across the Toronto region. So if you go to another testing center, the same criteria that we have.
That's good. That's important to know.
Yeah. I think that on those big kind of policy questions, what we want to do is we want to be as available as possible if things change, although it will be out of our control. If they do change and more people get tested, we have the capacity to test many more people.
Test result comes back positive or negative. What happens? Does that result come back to you folks, and then what?
So our whole team has really been navigating this process and trying to relieve some of the burden from public health. So at our site, at St. Michael's CAC, we've decided to take ownership of that process. And I think there's no harm in duplicating some of the processes at higher levels. I think patients want to know about both their negative and positive results. Obviously, positive results are communicated with greater urgency, but I think it's important to communicate all results, including negative results. So I think we've built in that process over the past week to communicate results for all.
We're now caught up, so if you get a result, once we get your result, we'll be able to communicate on the same day, positive or negative.
So phone call, something like that.
Yeah,
people leave
exactly.
What if somebody's result is positive? So one of the things you do is you educate people about what to do. So maybe you can help us now. So somebody's got a positive result.
Yeah.
What are they told?
So I've been calling those people myself, actually. So the people that have been positive, first thing I've wanted to do is ask them if public health has been involved in their case to understand if they've already gotten all this information. And then after that, I kind of just ask how they're doing. And, I think people, thankfully, they've been doing well. Everyone's still been at home. No one's had to come to the hospital. People have been suffering from flu symptoms. I think it's not been the greatest week or two for them, and they're asking when they think it can end. And I've reinforced the social isolation. Like, those are the people that really need to be perfect. So those are the people that cannot be leaving their house. They need to, if at all possible, be without any other human being in the house. Make sure if they're getting, like I've been suggesting, they get groceries delivered. Someone drops them off outside on their front porch or outside of the door to their condo, and then they let them leave, and then they pick them up later. Those are the types of suggestions we've been giving. Thankfully, I think that the people that I've talked to, it seems like they're all doing a really good job. I've given some suggestions if they do live with other people that can't go away on what to do as far as cleanliness, about wearing a mask, staying 2 meters apart, washing your hands a lot, trying to use a separate bathroom. And then the last thing is if they live with someone or they've had close contact with someone and they're at all unwell, then I say you get to think that this probably is COVID. We know it's a pretty transmissible illness. There's going to be a lot of cases in the community that don't meet the testing criteria right now. So if people are sick with these symptoms, I think they should assume that they have it. And the best thing they can do is just do the most perfect social isolation and distancing to not spread it to anyone else. And the last thing is I've instructed people on when they need to come back, when they may need to come back to an emergency room. Thankfully, the people that I've called, they've all been in maybe a bit of a lower risk demographic, people that tended to be young and healthier. And although we have seen or heard of cases of young and healthy people that get quite a severe illness, it is less common. And I reinforce that, the best thing they can do for our society is try to not give it to their parents or their, elderly neighbor across the street. And they have a service for the health of everybody.
What would be the advice for them to say if you get sort of to this point, you should go to emerge? Like, what would that advice be? So somebody doesn't stay at home too long and get too sick.
That's always an important question that patients have. So really, we're looking for patients with shortness of breath, chest pain, excessive fatigue. I think those are all persons that should present to the emergency department. And again, I think we haven't yet experienced positive results in some of the older patients with multiple comorbidities. And I think you probably lower your threshold with someone with coronary artery disease, chronic lung disease to perhaps present earlier to the department.
Yeah. If you're really short of breath at rest and you're too weak to be able to kind of take care of yourself, those are the kind of general terms I've been using on the phone.
So should they call 911? How do they get to emerge? So they should go to emerge. How do they get to emerge? Do you give them any advice about that? Should they call 911, get an ambulance?
Yeah, at that point, I think that it's important
to know they're coming.
So I would call 911 in that case, because I don't think it's definitely not safe to take public transit. I don't think it's safe to
just, and I can kind of come out of my room.
So just as of Wednesday of this week, March 25th, Ontario Health has outlined some guidelines that we're going to follow. So again, this is something mandated from above. Most patients will be considered well 14 days after the onset of their symptoms. Now, if they're in one of these high-risk groups, particularly healthcare workers, 14 days after the onset of symptoms, they'll need to undergo the test of cure. So it'll be the same nasopharyngeal swab that they perform to get tested, but now they'll need 2 negative tests separated by 24 hours to confirm test of cure, essentially to make sure that they are safe to return to their line of work, which may pose other people.
Risk to other people. So, but if I'm sick, I have COVID, I get better. So my cough goes away, I don't have a fever, I don't have a runny nose, all that's gone. how long after that's gone when can I come out of my room?
Right now, it's 14 days after
So
the onset of your symptoms.
So from the beginning of symptoms so at that point, everybody should be, the body's dealt with the virus. So I couldn't still be contagious at the end of that time.
Right.
So this 14-day number is kind of a couple of use. One is when you quarantine somebody for 14 days who didn't have any symptoms, we know that you don't have the virus because the incubation period is shorter than that. And if you do get the virus, 2 weeks, the body's going to deal with it and you're not contagious any longer.
Yeah,
so it's the same number.
The vast majority of people, in 2 weeks, you'll feel fine. And I think that the 14 days is what we want to do for those people. There is a few caveats. Like if you've got a tiny bit of a cough, like you can have a bit of a cough afterwards. And that's just related to some of the, inflammation and a bit of the damage what the virus has done. And they that's allowable. So you can still be 14 days. If you're feeling really sick though, I think that's when you got to talk to your GP and just maybe get a little bit more advice. So the 14 days, that's going to fit for 99% of the people. But if you're worried, you still have symptoms that's more than just the absolute most minor cough, then I think give your family doctor a call.
People have asked me, there isn't a phone number. I mean, if you're going to be assessed, you got to go and be assessed. There isn't a number to call that you guys answer the phone and give advice on the phone. You need to, people, if they want to be assessed, they actually have to come physically to where it is.
Yeah, our center is a walk-in center, mainly to serve the population in this area.
Right.
So our population is mostly a walking population within close vicinity. So we're there from 9 o'clock to 7 o'clock, 7 days a week.
So I'm getting close to the end here. So at this time, is there a big challenge that you're sort of wrestling with at the moment?
Yeah, I think we kind of feel like we're on the beach and there's a massive wave coming.
The tsunami.
Yeah. So I think dealing with that, and I think the next phase for us is probably going to be adapting our space to what it's needed to do next, I think. And we've already started doing next. We want to be ahead of the curve. And I think it's going to be the people that either know they have COVID or suspect they have COVID and are more sick.
Yeah, I think both Joel and I commented on Wednesday night how we're feeling this angst about how smoothly things are going right now. And we both want to prepare for the next phase.
So the worry is there's a wave coming and we all need to be ready. And obviously if people continue to stay home, distance themselves, maybe not socially, but physically distance themselves from other people, that can mitigate this wave.
Yeah.
That's our best advice. One of the things we like to ask, any sort of positive stories or something that's happened that just sort of really cool that you might want to share with us?
Yeah, I actually think there's lots of positive stories to go along with the assessment center itself. It's just been such a beautiful process to be a part of. There have been zero politics, zero bureaucracy. And I know Joel and I get a lot of the credit for this, but it's really been the whole team or the whole family at St. Michael's Hospital that has come together. Just seeing the construction crew there at 5 o'clock in the morning, just working through the night, cleaning staff, clerical staff, admin from various areas of the hospital, just dropping all of their other responsibilities to be here and to serve the community. It's just been an amazing process to watch. And it's just always thankful that I'm part of the St. Michael's team.
Couldn't agree more.
Yeah.
So awesome. So Joel and Paul, thank you so much for giving us some of your time today. And on behalf of our listeners, the St. Michael's community, and myself, thank you for what you're doing. This is extraordinary efforts. And I just to say, from my point of view, the assessment center concept and function is hugely important innovation during this COVID crisis. It does many things, but importantly, it gets citizens the information they need to look after themselves appropriately while keeping our emergency departments and our doctors' offices open and available for patients that actually need to be seen who don't have COVID. So can't thank you both enough for, again, your time today and for the work that you're doing on behalf of all of us. Stay well yourselves. Thanks.
Thank you.
And that's it for this episode of Facts from the Frontlines. To stay up to date and access all of our episodes, visit stmichaelsfoundation.com/COVID-19.